Today we're visiting the Physician Manned Rapid Response Unit here in Fredrikstad, Norway. With me I have the attending physician in charge of this project. And Anders, please tell me a little bit more about this project.
In Norway we have these emergency rooms located at the hospital, but we also have the smaller municipal emergency rooms located throughout the country due to, among other things, long distances from the community where people live to the hospital, and also sometimes bad road conditions. This is one of the units responding from the local emergency room in Fredrikstad. What we do is that we bring a nurse or paramedic with the doctor out to the scene where the patient is in dire need of our help.
And the nurses, paramedic and doctors, what kind of competencies do they have?
Well, the doctors are mostly generalists. The closest thing you could get to other systems is general practice. But of course, we only work with emergencies. But we also have some other specialists like anesthesiologists. But the main thing for all the doctors is that they have many years of experience doing emergency medicine in the local communities, experience working pre-hospitally, like with this car behind us.
What about the nurses and paramedics?
Well, they also have longer experiences in emergency medicine, working from the local department and pre-hospital emergency medicine.
You told me that the car is primarily staffed by generalists, so you don't bring like advanced airway skills to the table. What can you offer them?
There's a lot of emergencies, like medical and traumatic emergencies, but it is really seldom that we use inotropes or sedation or endotracheal intubation. So what we do is that we take care of the larger part of the emergency medicine field, and of course when it's needed, we have the possibility of also calling anesthesiologist with us, often by car or by helicopter. And sometimes the car is staffed by anesthesiologists with general practice experience.
Anders, what kind of calls do you typically respond to?
The most typical missions for us is difficulty breathing, infections and trauma.
Who dispatches your unit, and what kind of services can you offer that a regular ambulance can't?
Approximately 60% of the cases, it's the central dispatcher, the EMCC, Emergency Medical Communication Center, and then 40% there's call center in the local emergency that gives us the missions. What we can offer is first and foremost maybe the competence of the doctor in diagnostic terms, but also of course in some of the more severe accidents and medical emergencies, then we can offer a different kind of treatment than the regular ambulances.
What kind of effects have you seen in your community since starting this project a few years ago?
I think one of the biggest impacts we have had is that we have a larger opportunity now to treat people on site, meaning that we can do the primary diagnostics and treatment where the people call from. So usually typically we can go to a nursing home or to a regular home and treat people without using more resources on transport, ambulance transport from the home to the treatment center and back and so on. So I think it's important in a time where the resources are so few that we try to treat people on the lowest possible level while maintaining the safety, of course, for the patients. And I think this is one of the things that the physician manned unit can provide.
Anders has told us that some of the things that the Physician Manned Unit can bring to the table is advanced diagnostics and treatment. And please follow us to the next video where we go through all the equipment that Anders has in his car.